And we are also going to be talking about oral health. Now, this week we are hosting oral health interviews on Clicks Live. And of course, this is all in the lead up to World Oral Health Day on the 20th of March, 2022. Last year, the FDI World Dental Federation launched their 3-year campaign theme, Be Proud of Your Mouth. Be proud of your mouth is not about having a perfect mouth, it is also about having a healthy one. The World Dental Federation would like people to value and take care of their oral health and to make the correct decisions in order to protect oral cavity. This good oral status will require a lot of action. Be proud of your mouth by doing this. For example, be proud of your mouth by visiting the dentist regularly. Be proud of your mouth by brushing your teeth twice a day. Be proud of your mouth by cutting down on sugary sweets. To inspire action, we need to explain why, and this is where the campaign strapline fits in. In 2021, the World Dental Federation encouraged the public to take action by focusing on the importance of oral health in order to enhance oral overall health. Now in 2022, they are reiterating this message by highlighting the fact that an unhealthy mouth can severely impact every aspect of life. That is why they are calling upon everyone to look after their oral health for their happiness and well-being. Today's oral health interview is proudly brought to you by the South African Dental Association, known as SADA or SADA, in association with OHASA. SADA's vision is to be recognized as the trusted leader and voice of oral health care in Southern Africa. Their mission is to promote the interest and serve the needs of their members, and above all, encourage optimal oral health care for all South Africans. Learn more about the South African Dental Association by visiting sada.co.za. All right, so joining me on the line is Kaokie Sepuru. Good afternoon. Hi. And welcome. Oh my goodness, I am so happy to chat to you today.
Hi, Robin. I'm also excited to join everyone today on the show.
Thank you so much. And of course, the topic for today that I would just love to chat to you about is the causes and management of oral conditions like halitosis, gingivitis, hope I'm saying that correctly, tooth decay, and how to maintain optimal oral health. Now, in front of me, I've got this beautiful bio all about you, right? But I would just love if you could tell us all about yourself. Introduce yourself to us.
All right, so I'll just summarize it. So I'm known as Kaokie, and my full name is Mmakaoka Sepuru, and I'm an oral hygienist, and I've been working for 6 years. I've got 6 years experience. I studied my degree at the University of Pretoria in 2012, and work experience, I worked in orthodontics, where we, obviously most patients know, it is braces.
I was about to say that.
Yeah, and I decided to broaden my horizons and venture into general dentistry. Mm-hmm. And I'm currently working at a prosthodontic practice in Waterfall. And most people who don't know what prosthodontists do, well, a prosthodontist is she's a specialized dentist who works with crowns, bridges, implants, facial prosthesis. So if you lose a part of the face due to an accident or anything like that, that's what a prosthodontist does. Yeah. And I've worked with corporate companies. I'm also on a mobile dental unit that travels South Africa, and it actually helps remote areas in South Africa, and it provides free dental treatment for underprivileged communities and schools.
Wow.
And I'm also part of OHASA, as you would have heard in the introduction. OHASA is the Oral Hygiene Association of South Africa, and I am the Gauteng branch chairperson from 2017 until present. They won't let me go. And I'm an EXCO member as well. And I believe that education and information on oral health conditions from a young age can instill the correct habits, and having them practiced throughout life is exactly what everyone needs. And I believe that empowering a young mind, or even changing the mind of an older person, is all that is needed to keep everyone's mouths cavity and pain-free.
Thank you
and that's my bio in a nutshell.
Thank you so much for everything that you are doing, especially in the community as well. It's so important for more people like you to just go out there and also just spread the love and also help those people that really, really do need it so much. So I just want to just take the time right now to say thank you so much to you for that. It is absolutely amazing. And thank you for this bio and just introducing yourself so wonderfully to us and just making us feel the love for dentistry. All of a sudden, I want to go brush my teeth.
Please do, yes. And I know Clicks has a few products that will help with that.
Yeah, we've got a 3 for 2 at the moment where you can buy any 3 oral healthcare products from the same offer, getting the cheapest one absolutely free, which is awesome. I'm sure you are definitely behind that, right?
Yes, I normally go into Clicks and I'm the random person who will be standing in the dental aisle who will just decide to give someone more information if they're looking a little bit confused. So, yeah, most of the times the people who will just give you information are normally your oral hygienist or your dentist, who can see that you might look a little bit worried in front of the aisles with 500 different toothpaste and toothbrushes.
I am so glad that you are there then. And I'm so glad that you're with us, because now you can actually give that information to everybody in Botswana, Eswatini, Lesotho, Namibia, and across Mzansi. So today we are going to be talking a little bit about halitosis, gingivitis, etc., etc. So my first question would then be, what is halitosis and what are the causes of it?
Okay, so halitosis sounds like a very daunting word, but it's actually known as persistent bad breath. And it's normally caused by underlying medical conditions, incorrect oral health habits, dehydration, and even certain foods. So the biggest cause would actually be poor dental hygiene amongst the list. And I can give you just a few reasons why you would have halitosis or the causes. I mean, some patients that I've seen have diabetes, they have acid reflux, they have throat or mouth cancer, they have liver disease, they have smoking, or they actually have, or they smoke or use tobacco. They're not brushing the tongue, and there's plaque and calculus deposits, and sometimes even tonsil stones. Most people have these little yellow stones that give off a bad odor at the back of the mouth whenever they're sick or whenever they have infection in the body. And yeah, it sometimes does come out and presents itself as bad breath, which is halitosis.
All right. Now, how do I know if I've got these yellow stones?
So with the tonsil stones, they actually come out. So you won't miss it. Yeah. So you definitely won't miss it, and it does have a bad odor. And for things like that, you'd need to see an ENT. So remember, with oral health, everything is connected. The doctors are all connected. So you need to work with an ENT, you need to work with your oral hygienist, you need to work with your dentist, and you need to work with your GP. So we all are like a multifactorial team, and we just provide better health to everyone. Because, I mean, remember, the body is all connected, and everything starts normally in the mouth and spreads to the rest of the body.
All right, so let us say, for example, I'm going to use myself as an example, although this is not true. I'm just going to say this is not the truth. But let's say I go and I speak to people and I notice that they kind of back up when I speak to them. And then I start to notice, you know what, maybe my mouth isn't smelling too good. Maybe I've got halitosis. And maybe this is happening more often. And maybe it is the permanent, I'll call it permanent, that I've got this bad breath. Because, you know, sometimes you don't drink a lot of water and you find that it affects your breath, as you so mentioned a bit earlier on. Now, my question is now that I've got this, well, I don't have halitosis, but let's say, for example, I did, or at least I don't think so. Now, let's say I've got it. How do I completely remove this bad breath? Can I? Or is it always going to be there?
So it's dependent on the reason for the bad breath. My first thing would be ask the people who are closest to you if they do get a smell that comes from your mouth, okay? If you're a little bit self-conscious, the strange thing to do, I know it sounds strange, but you lick the back of your hand, wait for it to drop. Your hands are pretty clean. Sorry, with COVID, we're supposed to be washing our hands all the time. So you lick the back of your hand, wait for it to dry, and then you smell it. And if it's got a bad smell, that's the first indicator to tell you that you've got a problem with the mouth. And from there, that's when you know, okay, stand in front of a mirror and look at your teeth. Actually look at the teeth and look at the gums. Check if there's any colors on the teeth, if there's any random deposits on the tongue as well. Sometimes the tongue goes a little bit brown or a little bit black, and that might not be a problem. That could just be because of the food that you're eating. But if you're getting a persistent smell, then you'd need to go in to get your oral health checked. And remember, you should be going to see your dentist and your oral hygienist every 6 months. So this is for us to check and see what is going on in the mouth and give you a diagnosis. So we might be able to tell you exactly what is going on. So you might think that your bad breath is from eating garlic or whatever it is, but it might actually be from plaque that you're not removing properly. And normally with most oral hygienists, or what I am, you take photos of the mouth and we actually show you how the mouth is looking on the inside, because I know a lot of people don't really see that. You only see what you see. But once you see it, and when someone else sees it, someone who is a trained professional or the healthcare practitioner, and if we see it, we'll be able to tell you, okay, this is exactly what is happening in the mouth, and we diagnose what's going on and give you a definite answer. And yeah, that's normally how we diagnose if he's got halitosis or not. But it starts with you and the people around you, and you need people who are honest. That's very important.
I feel so awkward about that. Imagine going to someone and be like, excuse me, can you just like smell my breath quickly, and then also smell my breath tomorrow, because I want to see if there's a pattern of perhaps if I've got
this way. You're now wearing masks. So your mask is also the first
exactly right
of the bad breath. Because remember, the bad breath is beyond the saliva, and remember, when you talk and when you breathe,
you smell your own breath.
Yes, that is exactly it. So you're the first person to know.
Oh my goodness. Oh my goodness. I don't know about anyone else, but when you started talking about, checking in the mirror and also like licking your hand and smelling it, I don't know about anyone else, but I just, as you said it, I licked my hand and I smelled it. I was like, I need to do this test.
Yes. There are various tests that can be done at your oral hygienist as well. There are certain machines that we use. So, look, we're not going to leave you in the lurch. We have to be very honest. I mean, if we're not honest, who will be? Yeah.
Exactly. And we pay you to just be honest with us, and also to correct the situation as well, because you'll be able to tell us, all right, it is because you're not brushing your teeth adequately. Maybe you're brushing your teeth too little. Sometimes people brush their teeth, but they're not actually thorough with the brushing,
Correct.
My mom always tells me, like, can you please just brush your teeth just a little bit longer? And she stands there for like 10 minutes brushing the teeth. And she's like, and then you also have to brush the tongue. Oh my word. I don't know. She's too much for me. But I definitely did that test now with the licking of the hand. I don't know about anyone else, but I'm definitely going to do the rest of the test as well. Thank you very much for that, Doc. It felt very weird to be able to do that on live radio. Thank you. So are there certain foods that make the bad breath smell worse, for example?
Yeah, look, it's not specific, but I mean, I know it's a lot of patients. Things like garlic and onions and dairy, strangely enough, canned fish, horseradish, coffee, amongst that's just a list of some of the foods that actually cause bad breath. But remember, it may just be because you're not removing the food from the mouth sufficiently. So you might be brushing, and you might be brushing for 30 seconds. I know we see with a lot of kids, they are the number one culprits because kids will brush their teeth for 30 seconds and they'll eat the toothpaste and then they'll run out, and the parents might not be able to see what's happened. So you need to make sure that when you're brushing and you're flossing, you remove all of that plaque and that bacteria, and you stand in front of a mirror and you lick your teeth. That is also a good way to just check that you're removing all of the food, and you lick your teeth. Strangely enough. Food, that is a problem. That's an indicator to show that there might be plaque. So right by the teeth and the gums, that is the number one indicator area.
All right, wait. Wait. Hold up here. I feel like at this point I actually need to ask you, how do we brush our teeth properly? So we brush it for how long?
Okay, so I normally tell patients to brush for 2 minutes. How this works is it's 30 seconds on the top arch of your teeth, so the top teeth, on the front. then 30 seconds on the bottom teeth on the front. Then you open your mouth, and then you brush in circles, 30 seconds on the inside at the top teeth, and then 30 seconds at the bottom teeth, and you go around in circles. And it's quite important to make sure that you don't just brush your teeth. You need to make sure that you brush the gums as well. But now it becomes more intricate. You should be using a soft toothbrush, because using a hard brush would actually end up causing you to hurt your gums. Now, it's quite important that you remove the plaque from the teeth and the gums, because remember, the one topic that we're going to be speaking about is gingivitis, which is a disease of the gums. And that's caused by not brushing the food and the bacteria off the gum line. So the teeth are secondary. The gums are the most important part in the mouth, because remember, if anything happens with the gums, the teeth are going to follow. And that's what's important to remember.
And then, hold up quickly, do I then floss after that? And then
Yes.
and then do I use the mouthwash?
Yes. So it's best to, it's different with every practitioner, but I've seen that with a lot of my patients, brushing first and then flossing between the teeth, and I normally do this at night. I know it's a bit difficult for patients or some people to floss in the morning because you're rushing. Rather do it at a time where you actually have time to floss in between every single tooth space, right? Once you're done with the flossing, you need to make sure that you use a mouthwash, but mouthwashes are an auxiliary aid, so it doesn't replace removing the plaque and the bacteria with the toothbrush. So the brushing is the most important, but mouthwash is just an added benefit to help with any bad breath that you might be having, and it also freshens the breath, and if the mouthwash is medicated, it may actually kill the bacteria that may be in the mouth. But this is all patient-specific. So if you need to be using a medicated mouthwash, your dentist or your oral hygienist will give you this information as well. And if you ever see that you are using a medicated mouthwash, you shouldn't be using it for longer than a week. But it all is patient-specific, as I mentioned, and that's why it's so important to go see your dental practitioner, because they would give you the information on what to use, what not to use, and how to use it as well. That's quite important to remember.
Awesome stuff. And another thing that we definitely need to remember is the fact that we've currently got a 3-for-2 special or promo on all of our oral health products from the same offer. You can get the cheapest one absolutely free. And of course, that includes the kids' stuff as well. I know you mentioned that because I definitely see that with my niece and my nephew. They brush their teeth, but then they end up just like starting to eat the toothpaste, which is very counterproductive. I got to actually say to you that I don't brush my teeth for as long as you say that I should, and I should really implement that. So thank you for the time measurement that I'm supposed to use, so that's also very important. Thank you very much for that. So if my gums are actually bleeding, what are the causes of that, and can the bleeding actually stop?
Okay. So I might have just touched on it in the previous question, but normally when gums bleed, it's caused by the infection on the gums. And it's literally the food that is sitting on the gums that's irritating the gums. So when your gums bleed, it's literally your body saying, something's wrong, help me. And it's crying red tears. And the red tears would be the blood. So you need to look in the mouth when you're brushing and check where the bleeding is coming from. Because that's the best indicator to tell you where the infection is. And a lot of my patients who have just started with me will always say, I was brushing my teeth and I was flossing and it was bleeding, and I stopped. And I'm here to tell you today that you should actually be doing the opposite. If there's bleeding, if there's any infection in the mouth, you don't stop brushing that area. Your body is literally telling you exactly where to focus. So you brush more, floss more, and remove all of that plaque and that bacteria. Because the saying is that healthy gums don't bleed. So you need to make sure that your gums aren't looking a bright red color, and they're not swollen and bulbous. They should be a flat pink or coral pink color, and adhere to the teeth. If your gums are flapping around a little bit, that's when you know that there's a bit of a problem. Because remember, if your gums are loose from the teeth, it means that food can be getting stuck in between the gum and the tooth area, causing further infection, and that's what causes the bleeding. It's the irritation on the gums.
So it's not necessarily because I'm brushing too hard or flossing too hard.
It could be. So that is also another reason. But remember, first you need to check the state of your gums, because there are patients with healthy gums, and you might just hurt yourself one day. But remember, now that's when you should be using a soft toothbrush. So if you're using a soft toothbrush and your gums are still bleeding, then it's telling you, that's an indicator you've got gingivitis. And the good thing is that gingivitis it's a disease of the mouth, right? But it's reversible. So it's reversible if you start looking after your mouth properly. If you start brushing properly, if you start flossing and using the correct oral hygiene aids, then that's how you remove the gingivitis. And we always need to make sure that we can stop the gingivitis, which is that disease, before it progresses into a more severe disease of the mouth. Okay, so we hope to stop it when it's still a gingivitis. You don't want it to progress into periodontitis and other infections as
periodontitis. Thanks. Periodontitis. Oh, I new names every day. I just learn new things every day. It's absolutely amazing. Now, does using a harder toothbrush and even brushing faster maybe clean my teeth better?
So I know in the olden days, grandparents used to tell their kids and grandkids, you have to brush very hard and you have to use a very hard toothbrush. But it's actually the opposite. I tell my patients to use the hard toothbrushes to clean their shoes. The soft toothbrushes are the only brushes, so soft to medium are the only brushes that I recommend that patients use in their mouths. Reason being, remember, you're not just brushing your teeth. You're brushing your gums as well. And if you're using a hard brush, you might end up hurting yourself, and you need to be using a soft toothbrush to remove all that bacteria in the plaque. Now, I've seen with a lot of patients who haven't been for their cleanings in 6 months. Remember, you get the plaque that builds up if it's not cleaned properly. And you may feel like the soft toothbrush just doesn't clean properly. That's because the plaque that's on the teeth, it's formed layers of that plaque. So it's going to be very difficult to brush that off with a toothbrush. You need to go in for a professional scale and polish to remove that, it's called calculus, so that tartar deposit. You need to get that removed, and then you'll feel that a soft toothbrush is working effectively. Because in essence, it's like brushing the floor. Oh, have you ever swept the floor, a ceramic tile, Robin?
Have I ever fixed the floor?
Swept a ceramic tile, yes. The smooth tile that you can slide on with your socks.
Yes.
Yes. Now, what cleans it better, a soft broom or a hard broom?
Wow, you're asking someone who doesn't do much housework.
Okay, I'll give you the answer. The answer is a soft broom, because the soft broom actually picks up on the dirt.
All right.
The hard broom, you actually end up having to scrape even more and clean even more. So that's the mechanism behind using a soft toothbrush. It cleans better than using a hard brush.
So we don't need to get like a million toothbrushes, like one for like a certain part of our mouth and another one